Can you briefly explain how the liposuction procedure is performed?
Principally, liposuction is taking the fat cells out of the body. It's not one of the methods of losing weight, because when you try to lose your weight, if you do exercise or if you go on a diet, start a diet, what you're going to do is just changing the volume of the fat cells where the fats are being stored. But in liposuction, physically, you are reducing the number of the fat cells by just taking them out of the body. So when you do this, there are some options like traditional liposuction, and then in the beginning of 2000 they start the ultrasound liposuction, and then the laser liposuction has arrived, and today we are using a VASA laser. They are all the different instruments to traumatize the fat cells to make them easier to be taken out. So in any liposuction, what you do, as I said, taking the fat cells physically out of the body so that the number of the fat cells in that particular area will be less, so that it will be in the long term there will be no possibility of having it, the fat the tissue coming back again. Okay.
And what are the differences between laser liposuction and traditional liposuction?
Well, as I said, I've just mentioned traditional liposuction, laser, ultrasound liposuction, or laser liposuction. These are different techniques to damage the fat cells to make it easier for the cells to be taken out. With the ultrasound, you're doing it with the sound waves. With the laser lights, sort of thermal trauma. With the laser liposuction, we are using radio frequency waves. But because the ultrasound was not effective enough, and as for the laser, it was not possible to work on the superficial layer because the laser would be burning the skin on top of it. So laser liposuction with the radio frequency waves are both safe and effective. That's why we are using laser liposuction.
How long is the recovery period after liposuction procedure?
Depending on the amount of the fat you will be taking, perhaps more important that depending on how extensive your surgery will be. That's why we are not doing whole body liposuction, because just working on the upper body or the lower body would be enough as a trauma for the body. Because the more liposuction you will do, the more of the end product you will be sort of creating in the body in metabolical sense, and the kidney will have to handle this. So as I said, the amount of the fat, how extensive it is, and the age of the patient, the duration of the procedure, all sort of putting extra risks. So you should take into account every parameters together, and then you can decide how much fat you are planning to take out.
How and how long should be the medical garments used?
Well, as I say, as for the breast implants, the garments in the liposuction surgery is not something 100% requirement, but somehow logically it's more meaningful than the bras. Because after the liposuction, you are actually taking the support of the skin under the skin out. So the skin is expected to get sort of slack, to get loose. So the possibility of bleeding, under the skin would just make it difficult for the skin to stick to the layer underneath. So these garments will be applying a constant pressure, external pressure on the skin, so that there will be no edema or hematoma under the skin, and it will give some external pressure to the skin to stick to the deeper layer. But as I said, this is principally or theoretically something meaningful, but in reality what happens, I'm not sure that this pressure is enough if you have any bleeding under the skin. but somehow this garment, is some sort of the part of the procedure. Everyone expects, wearing these garments, and I believe that there's no harm in using it. And if you have just 10% improvement with the garment, it's worse. The duration of the garments, how long you're gonna wear it, depending on the skin quality, depending on how much the sort of the support the skin will be losing. I mean, in a young patient, very tight skin, I don't think more than 2 weeks would be enough. But if the patient has got already loose skin before the procedure, that means you should take every advantage of the garment. That means at least 4 weeks after the procedure.
And what is the maximum fat amount that can be?
There is no maximum for everyone. For you, it could be 4 kilos. For another patient, could be 6 kilos.
And how do you decide on the amount?
Well, even today, I can't tell before the surgery how much I'm gonna get it, because it depends on how easy you will get the fat out, and more important that if the patient starts bleeding anywhere you are doing liposuction, you should almost stop it. And again, the amount of bleeding in terms of losing the blood is one of the major parameters that you should take into account.
What parts of the body can be performed liposuction, and can upper and lower body liposuction be performed at the same time?
No, as I said, that will be a huge, big operation. But for instance, a patient like you, I could do the whole body liposuction because you're not very tall, you're not very overweight. So again, this question is something to do with the patient. It's not something a general rule is about. You can't do it. You can do this. As for what was your first question? The area, principally, you could do liposuction anywhere. But if the thickness of the skin is strong enough, the result of the liposuction there would be always better. For instance, doing liposuction here, because the skin here is too thin, so if you do just liposuction here, you would not be able to get the same tightness of the skin after the procedure if you do the surgery here, because the skin here is thicker.
Does it always give a good result for every part of the body?
No, as I said, depending on the skin quality rather than the area.
When will the patients be able to do sports after the procedure?
1 month will be enough.